Hello everyone, this is Rushil Reddy, and in this video let us discuss the topic about management of a wound, compartment syndrome and abnormal wound healing. This video is presented by MEDeaze and MBBS freaks. Before going into the topic about management of wound, first let us know what is wound debridement. Wound debridement is defined as excision of all devitalized tissues at regular intervals until a healthy bleeding vascular and tidy wound is created, which means there should be excision of the tissues until an untidy wound is completely converted to a tidy wound. Now let's see what are different types of wound debridements. The first being surgical, in which there will be excision of devitalized tissue using surgical instruments. Then comes mechanical debridement. Here the debridement is done using irrigation, that is hydrotherapy. In case of mechanical wound debridement, there will be excision of completely the viable as well as non-viable tissues. In autolytic wound debridement, there will be use of some hydrocolloids which create a moisture environment. Due to this moisture environment, the enzymes which are present nearby the wound will get activated and they cause liquefy of non-viable tissues. In enzymatic type, we induce some specific topical agents which contain the enzymes like collagenases. These enzymes cause wound debridement. In case of biological wound debridement, there will be use of larvae like Lucilia sericata. Lucilia sericata. This larva remove the necrotic tissue present at the site of wound. Here we can see the Lucilia sericata larva, and this is the process of wound debridement in which there is introduction of the larva into the wound which causes necrosis of the wound. Now, as a part of management, let us come to the suturing. First, we should know what are the principles of suturing. The first principle that should be known before conducting a suturing is that if there is any edema, inflammation, or any devitalized tissue at the site of wound, primary suturing should not be done. Then the second principle is injury to any deeper structure should be foreseen before closure of any wound. A proper cleaning and asepsis should be conducted and a sterile condition should be prepared before debridement. Presence of any foreign body at the site of wound should be removed. The untidy wound should be converted to a tidy wound. And the prophylaxis like any antibiotics should be given before suturing, and prophylaxis like tetanus prophylaxis should be given to avoid any kind of infection. After suturing, there should be a proper inspection of the suturing, and that the removal of suture should be done after 7 days. This will be the part of follow-up. Now, let's see what are the types of suturings. They are grouped as primary suturing, delayed primary suturing, and secondary suturing. Suturing within 6 hours after occurring of the wound is called as primary suturing. In case of delayed primary suturing, the suturing is done after 48 hours to 10 days of duration. Here, the time is allowed for subsiding of any edema which is present at the site of wound. Here, we have seen presence of any edema or infection at the site of wound, the primary suturing is avoided. So, that's why we conduct the delayed primary suturing after subsiding of any edema present at the site of wound. Then secondary suturing is done at the time of 14 to 10 to 14 days or later. This suturing is done after complete control of the infection at the site of wound and after appearance of granulation tissue. These are the major types of suturing. Now let's come to the first part, that is wound cleaning. This is the foremost thing which is done during the process of management of wounds. The first step of wound cleaning is removal of devitalized tissue, which is nothing but wound debridement. Then there should be a warm, sterile, isotonic normal saline which is used as the cleaning agent, like, and the characteristic of the cleaning agent should be of neutral pH and should be non-toxic, and the cleaning should be done completely in a sterile conditions. Wound cleaning is the first process which should be done before going into the specific management of a wound. After completing the wound cleaning, we go to the specific management of wound. Here, the wound should be properly inspected and classified as per the type of wound. The types of wound could be incised wound, lacerated wound, crushed or devitalized wound, deep vitalized wound, wound with tension, and vascular or any nerve injury. In case of incised wound, primary suturing should be done after cleaning the wound. In lacerated wound, the wound is completely excised and primary suturing is done. In case of crushed or devitalized wound, there will be edema which should be given time to get completely subsided, and after subsiding there will be delayed primary suturing. Primary suturing is completely contraindicated in case of presence of any edema or infection. In case of deep vitalized wound, there will be complete excision of the wound and the wound is allowed to granulate first. After formation of a granulation tissue, if the wound is small wound, there will be secondary suturing. If in case the wound is a large wound, there is a graft used called as thirst graft which is used to cover the wound. If it is a small wound, we conduct secondary suturing. If it is a large wound, we apply a thirst graft to cover the wound. In a wound with tension, we conduct fasciotomy. Fasciotomy is conducted in order to prevent the compartment syndrome, which we're gonna see in the next part of video. In case of vascular or nerve injury, we use a 6-0 polypropylene suturing material which is non-absorbable. This is a suturing material used to suture the vascular or nerve injuries. This was about the management of a wound specifically. Now let's come to the compartment syndrome. The syndrome, which is due to increased interstitial pressure within a closed osteophacial compartment. Osteo means bone, fascia, that is deep fascia. Osteofacial compartment, which results in microvascular compromise, mainly to the muscles. Due to an interstitial pressure which is created in the osteofacial compartment, there will be compromise of microvascular supply to the muscles, which leads to a compartment syndrome. The causes to the compartment syndrome could be fractures, edema, ischemic injury, hematoma, positioning after any trauma, and burn injuries. The classical features of a compartment syndrome can be seen as there will be compromisation of the circulation to the muscles, there will be death of muscle tissue, and we can also see damage to any of the nerves. What could be the complications of compartment syndrome? They are like infection, renal failure, any septicemia, rhabdomyolysis, which is related to the muscle tissue, amputation of the limbs, and disabled limbs or Volkmann's ischemic contracture. These are the complications which should be remembered in case of compartment syndrome. Now, when we come to the treatment part, the fasciotomy is a major treatment part in case of compartment syndrome. Fasciotomy is done while suturing any wound to avoid the compartment syndrome by relieving the pressure around the muscle by removing the complete fascia, deep fascia which is present around the muscle. For example, this is a compartment where there is a muscle which has microvascular compromise. So, in case of fasciotomy, we completely remove the fascia which is present surrounding the muscle. This releases the pressure around the muscle and the microvascular compromise can be decreased and there will be good supply of blood to the muscle tissue. Now let's come to the last topic, which is abnormal wound healing. This is seen as any aberrations or alterations in normal wound healing, such as increased or prolonged inflammation time, which leads to formation of excessive scar tissue, which could be an hypertrophic scar or a keloid scar. During formation of the scar, in hypertrophic scar, there will be disorganized pattern of collagen, whereas there will be an organized pattern of collagen in case of keloid scars. Let us see a table which depicts the differences between a keloid and an hypertrophic scar. This table shows the difference between keloid and hypertrophic scar in different traits, which should be remembered. By this, we end up the session. Thank you all.